Hello, I'm Dr. Robert Clark. For over 30 years, my life's work has been dedicated to helping seniors navigate the complexities of their health with clarity and confidence. Today, we need to have a serious conversation about a silent danger that affects millions. Did you know that if you are over 60 and living with diabetes, there is a 1 in 3 chance that you also have chronic kidney disease and you might not even know it? That statistic isn't meant to scare you, it's meant to empower you. It's a wake-up call that your kidneys, those two tireless bean-shaped organs, need your protection now more than ever. They are the master purifiers of your body, and when they are under threat from high blood sugar and high blood pressure, the consequences can be life-altering. But here's the good news, and I want you to hold on to this. You are not powerless. There are natural, evidence-based strategies that can dramatically slow, and in some cases even halt, the progression of diabetic kidney disease. Today, we are going to walk through the most powerful of these strategies, starting with the very foundation of your health: what you put on your plate. Our first and most crucial strategy is embracing a way of eating that actively fights inflammation and protects your kidney-as delicate filtering units. This isn't a restrictive, joyless diet, it's the vibrant, delicious, and deeply researched Mediterranean diet. I remember a patient of mine, Arthur, a 72-year-old retired teacher who came to me feeling completely overwhelmed. His blood sugar was poorly controlled, and his kidney numbers were starting to decline. He felt like he was failing. He'd heard about the Mediterranean diet but imagined it was complicated and expensive. We started small. I asked him, "Arthur, what's one change you can make this week?" He decided to swap the butter he used on his morning toast for a drizzle of extra virgin olive oil and to have fish for dinner twice a week instead of steak. Within a few months, he was adding more vegetables, nuts, and whole grains. 6 months later, his inflammation markers in his blood work had dropped significantly, his blood pressure was down, and his kidney filtration rate, his eGFR, had stabilized for the first time in 2 years. He wasn't just managing his disease, he was thriving. He felt better, had more energy, and rediscovered a love for cooking. His story shows that this isn't about perfection, it's about progression. The science here is incredibly clear. The chronic inflammation caused by diabetes is like a low-grade fire smoldering through your blood vessels, including the microscopic ones in your kidneys called glomeruli. The healthy fats in olive oil and nuts, and the omega-3 fatty acids in fish like salmon, are powerful anti-inflammatories. They act like a fire extinguisher, calming that damaging inflammation and easing the relentless pressure on your kidneys. So, let me ask you, what is the single biggest source of unhealthy fat in your diet right now? Could you swap it for a healthier Mediterranean-style option, like using avocado instead of mayonnaise on a sandwich? A practical step you can take tonight is to build a Mediterranean-inspired plate. Half your plate filled with non-starchy vegetables like broccoli or a leafy green salad, a quarter with a lean protein like grilled chicken or fish, and a quarter with a whole grain like quinoa or a small piece of whole wheat bread. Drizzle it all with good quality olive oil. This simple change shifts the balance from pro-inflammatory to anti-inflammatory, and your kidneys will thank you for it. Building on the foundation of the Mediterranean diet, we can supercharge our kidney protection by focusing on 2 specific types of nutrients: prebiotic fiber and antioxidants. This might sound technical, but the concept is beautifully simple. Feed the good bacteria in your gut and eat a rainbow of colors. Let me tell you about Eleanor, an 80-year-old grandmother whose main struggle was her blood sugar. It was on a constant roller coaster, and this instability was putting immense strain on her kidneys. She was eating what she thought was a healthy diet, but it lacked variety and fiber. We focused on one thing: adding prebiotic-rich foods to every meal. We added a scoop of beans to her lunchtime soup, a handful of berries to her morning oatmeal, and a side of asparagus with her dinner. Prebiotic fiber is what the beneficial bacteria in your gut, your microbiome, love to eat. When they are well fed, they produce compounds called short-chain fatty acids, which have a profound positive effect on your entire body. For Eleanor, this improved her insulin sensitivity, meaning her body could use sugar more efficiently. Her blood sugar levels stabilized, the roller coaster stopped, and the daily assault on her kidneys lessened. Her story perfectly illustrates what scientists call the gut-kidney axis. An unhealthy gut contributes to inflammation that harms the kidneys, while healthy fiber-fed gut bacteria actively protect them. What does this look like in your kitchen? It's adding lentils to your stews, choosing whole grain bread over white, and snacking on an apple instead of crackers. Now, let's talk about antioxidants by eating the rainbow. Oxidative stress from high blood sugar is like rust forming on the delicate machinery of your kidneys. Antioxidants are the rust proofers. Each color in fruits and vegetables represents a different family of powerful antioxidant compounds. The lycopene that makes tomatoes red, the anthocyanins that make blueberries blue, and the beta-carotene that makes carrots orange all work in different ways to neutralize the damaging free radicals that cause this rust. I often ask my patients, how many different colors did you eat yesterday? Was your plate mostly brown and white? A simple, practical goal is to try to get 3 or more natural colors on your plate at every meal. Think about it. A breakfast of oatmeal with blueberries and walnuts, a lunch with a spinach salad topped with red bell peppers and chickpeas, and a dinner of salmon with a side of sweet potato and green beans. You've just effortlessly consumed a symphony of protective compounds. So, take a moment to reflect. Are you actively feeding your gut microbiome with fiber-rich foods? Is your plate a vibrant canvas of colors, or is it looking a bit bland? While the Mediterranean diet provides a fantastic framework for those of us dealing with high blood pressure alongside diabetes, which is most of us, we need to incorporate the principles of another clinically proven eating plan, the DASH diet. DASH stands for Dietary Approaches to Stop Hypertension, and it is one of the most effective non-pharmaceutical tools we have to protect our kidneys. High blood pressure is a silent, relentless force of destruction on your kidneys. I want you to imagine a delicate silk filter. Now, imagine blasting it with a pressure washer set to maximum. Over time, that silk is going to fray, tear, and be destroyed. That is exactly what uncontrolled hypertension does to the fragile filtering units in your kidneys. This brings to mind my patient Frank, a 68-year-old retired long-haul truck driver. His diet for 40 years had been one of convenience: truck stop diners, salty processed snacks, and sugary sodas. His blood pressure was stubbornly high, even with 3 different medications. His kidney function was beginning to decline, and he was scared. The thought of giving up salt felt like giving up all flavor. So, instead of focusing on what to remove, we focused on what to add, a core tenet of the DASH diet. We worked on increasing his intake of potassium from foods like bananas, spinach, and potatoes, and magnesium from almonds and black beans. These minerals help the body naturally excrete sodium and relax the blood vessel walls. He started swapping his salt shaker for a blend of herbs and spices. Within 3 months, for the first time in a decade, his blood pressure dropped into the target range. We were even able to reduce one of his medications. His success wasn't about deprivation, it was about smart additions and substitutions. The science is elegant. The DASH diet works by creating a perfect balance of minerals that counteracts the pressure-raising effects of sodium. It's not just about low salt, it's about high potassium, magnesium, and calcium. A practical step you can take today is to read the label on your favorite canned soup or frozen meal. You might be shocked by the sodium content. A better choice is to make a large pot of vegetable soup at home, where you control the salt. And what about hydration? It's a delicate balance. Adequate water is essential for your kidneys to flush out waste products like urea. When you're dehydrated, these toxins become concentrated, forcing the kidneys to work harder. However, drinking excessive amounts of water can be dangerous if you already have advanced kidney disease. A good rule of thumb for most people is to drink enough so your urine is a pale, straw-like color. Have you considered how much hidden sodium is in your diet from processed foods? Are you drinking water consistently throughout the day? Or are you waiting until you feel the sensation of thirst, which is actually an early sign of dehydration? Now, let's venture into a very confusing and often expensive territory: supplements. The aisles of pharmacies and health food stores are filled with bottles promising to protect, cleanse, and rejuvenate your kidneys. It's a tempting idea that a simple pill could solve a complex problem. But as your doctor, I have to guide you with science, not marketing. And the hard scientific truth is that most of these supplements are a waste of money for kidney protection, and some can even be harmful. I had a patient, Susan, a retired librarian who was incredibly diligent about her health. She would bring in a bag of 15 different supplement bottles to her appointments, each one meticulously researched on the internet. She was spending over $200 a month on things she believed were shielding her kidneys from her diabetes. She was taking high doses of vitamin D and fish oil, among many others. It was difficult to have the conversation, but we had to look at the evidence. I pulled up the results of a major high-quality clinical study called the Vital DKD trial. This wasn't a small biased study, it involved thousands of people, and was designed specifically to see if vitamin D and omega-3 fish oil could prevent kidney decline in people with diabetes. The result was unequivocal. They did not. There was no difference between the people taking the supplements and those taking a placebo. Susan was stunned, but then she felt a sense of relief. We refocused her energy and her budget on the things we know work, like buying fresh vegetables and fish. The allure of a quick fix is powerful, but we must follow the data. The reason these supplements likely failed is that diabetic kidney disease is a complex process driven by inflammation, high blood pressure, and high blood sugar. A single nutrient in a pill is unlikely to overcome these powerful forces, whereas the synergistic effect of whole foods, like in the Mediterranean diet, works on multiple pathways at once. Now, you may have heard about other promising supplements like magnesium or garlic. And it's true, there's a theoretical reason they might help. Magnesium can help with blood pressure, and garlic has antioxidant properties. But promising and proven are two very different things, especially in senior health. We don't have large-scale, long-term studies in older adults with diabetes to confirm they are both effective and safe for the kidneys. So my professional advice is to save your money. Focus on a food-first approach. Instead of an omega-3 pill, have a delicious piece of baked salmon. Instead of a kidney cleanse formula, drink adequate water and eat high-fiber foods. Before you take any supplement, I urge you to ask yourself two questions. Am I taking this based on a compelling blog post, or a direct recommendation from my doctor based on my specific blood work? Have I checked with my pharmacist to ensure this supplement won't interact dangerously with my prescribed medications? If diet is our offense, then monitoring is our defense. You cannot protect what you do not measure. In the battle to save your kidneys, there are 3 critical numbers you must know, understand, and track over time: your eGFR, your urine albumin to creatinine ratio, and your blood pressure. Ignoring these numbers is like flying a plane without an instrument panel. You might feel fine, but you could be heading for serious trouble. Let me tell you about George. At 75, he was an avid golfer who felt he was in perfect health. He had no symptoms whatsoever. During his annual physical, his routine blood test showed an eGFR of 65, which is fine. But I always insist on a urine test as well. That simple urine test revealed a small but persistent amount of a protein called albumin. This was the canary in the coal mine. It was the very first whisper of kidney damage, long before his filtration rate started to drop. Because we caught it so incredibly early, we were able to get much more aggressive with his blood pressure medication and make targeted dietary changes. Today, 10 years later, George is 85, still playing golf, and his eGFR has only drifted down to 58. That early detection, that simple urine test, saved him from a path that could have led to dialysis. It's a powerful lesson in the value of proactive monitoring. Let's demystify these tests. Your eGFR, or estimated glomerular filtration rate, is a score for your kidney function calculated from a blood test. Think of it as a percentage. A score over 90 is great. Over 60 is generally considered okay, but once it drops below 60, it means you have chronic kidney disease. The second test, the urine albumin to creatinine ratio, or UACR, is a leak test. Healthy kidneys do not let protein leak into the urine. When the filters are damaged by diabetes, they start to spill albumin. A UACR result under 30 is the goal. Anything above that is a red flag. Finally, your blood pressure. For most people with diabetes and kidney disease, the target is less than 130/80. I want you to feel empowered. The next time you see your doctor, I want you to ask, what were my last kidney numbers? What is my eGFR and my UACR? And what is our trend over time? Keep a small notebook with these values. You are the CEO of your own health, and this is your quarterly report. So, let me ask you, do you know your latest eGFR and UACR numbers? When was the last time you had both a blood test and a urine test to check your kidney health? Knowing your numbers is the first step to protecting them. One of the most dangerous characteristics of chronic kidney disease is that in its early stages, it is often completely silent. You can lose up to 50% of your kidney function without feeling a single symptom. However, your body does send out subtle clues, and learning to recognize them can be life-saving. These are not dramatic, fall-to-the-floor symptoms. They are quiet whispers that are all too easy to dismiss as just getting older. We need to learn to listen. The first subtle sign is often found not in how you feel, but in your blood pressure readings. If your blood pressure, which was once well controlled, suddenly starts becoming difficult to manage, requiring more medication or higher doses, this can be a sign that your kidneys are struggling. Healthy kidneys play a vital role in regulating blood pressure, and when they are damaged, this system breaks down. Another key sign is swelling, or edema. I think of my patient, Margaret. She first noticed that her wedding ring was feeling tight in the mornings. Then she saw that her ankles were puffy at the end of the day, leaving an indentation when she pressed on them. She told herself her ring was tight because of arthritis and her ankles were swollen from the summer heat. She dismissed it for months. It wasn't until she noticed a third sign that she finally spoke up. She saw that her urine in the toilet bowl consistently looked foamy, almost like the head on a beer. That was the sign she couldn't ignore. We discovered she was leaking a massive amount of protein, and her kidney disease was already moderately advanced. That foam was caused by the protein albumin, which when agitated in the urine stream, creates bubbles, just like an egg white. The swelling was happening because as she lost protein from her blood, fluid began to seep out of her blood vessels and into her tissues. Her kidneys were also struggling to get rid of excess salt and water. A fourth subtle sign can be changes in your urination patterns, especially at night. If you find yourself having to get up to urinate 2 or 3 times a night when you used to sleep through, this can be an early sign that your kidneys are losing their ability to concentrate urine. I want you to take a moment and think. Have you noticed any new or persistent swelling in your hands, ankles, or even around your eyes in the morning? Have you ever taken a moment to actually look at your urine before you flush? Dismissing these subtle signs is a gamble with your health. They are your body's early warning system, and ignoring them allows silent damage to continue unchecked. As kidney disease progresses from the early, silent stages to more advanced stages, the symptoms become much more pronounced and systemic. This is because the kidneys are no longer able to adequately filter waste products from the blood. These toxins build up, a condition called uremia, and begin to poison the entire body. These are not subtle whispers anymore. These are loud, unmistakable alarms that demand immediate medical attention. One of the most common and debilitating symptoms is a profound and persistent fatigue. This isn't just feeling tired after a long day, it's an overwhelming exhaustion that isn't relieved by rest. This happens for two main reasons. First, the buildup of uric toxins in the blood is draining. Second, and just as important, healthy kidneys produce a hormone called erythropoietin, or EPO, which tells your bone marrow to make red blood cells. When the kidneys fail, they stop making enough EPO, leading to anemia, which starves your body of oxygen and causes severe fatigue. I remember a patient named Bill, a stoic farmer who never complained about anything. He started feeling so tired he could barely get through his chores. Then he lost his appetite and noticed a strange metallic taste in his mouth. He chalked it all up to stress. His wife finally brought him to the emergency room when he became confused and couldn't remember what day it was. His lab work showed his kidney function was below 15%. The confusion, the nausea, the fatigue, it was all caused by severe uremia. This was a medical crisis that had been building for months. Other progressive symptoms include nausea, vomiting, and a complete loss of appetite as toxins irritate the stomach lining. Many people experience persistent, maddening itching all over their body, caused by the buildup of phosphorus in the blood. Muscle cramps, especially in the legs, become common due to imbalances in electrolytes like calcium and phosphorus. You might also experience shortness of breath, either from the anemia we discussed or from fluid building up in the lungs, a serious condition called pulmonary edema. These symptoms are a sign that your body is being overwhelmed. They mean that your kidney disease is advanced and that you are approaching the point where you may need dialysis or a transplant to survive. I don't share this to frighten you, but to impress upon you the absolute urgency of seeking help if you or a loved one experiences these things. Are you or someone you know dismissing persistent, bone-deep fatigue as just a normal part of aging? Have you experienced unexplained nausea or itching that won't go away? These are not symptoms to be ignored or endured. They are a cry for help from your body. We have discussed diet, monitoring, and the warning signs from subtle to severe. Our final critical piece of the puzzle is knowing when to bring a specialist onto your team. Your primary care doctor is your captain, but when you are dealing with chronic kidney disease, you need the expertise of a nephrologist, a kidney specialist. Delaying this consultation is one of the biggest mistakes I see patients make. There are very clear guidelines for when a referral is not just recommended, but essential. If your eGFR drops below 30, you need to be seeing a nephrologist, period. At this stage, the management of your condition becomes much more complex, involving bone health, anemia, and mineral metabolism that requires a specialist's touch. Another clear trigger is a rapid decline in your kidney function. For instance, a drop of more than 5 points in your eGFR in a single year. You also need an immediate referral if you have a large amount of protein in your urine, or if your blood pressure remains uncontrolled despite being on 3 or more medications. But I want to advocate for an even earlier approach. Don't wait for a crisis. Don't wait until your eGFR is 29. Let's end with a truly hopeful story. Meet Janice. She was 67, and her primary care doctor, who was wonderfully proactive, noticed her eGFR had slipped from 45 to 38 over the course of a year. He didn't wait. He referred her to a nephrologist right away. That specialist was able to make subtle but powerful adjustments. She changed one of Janice's blood pressure medications to a class of drugs called SGLT2 inhibitors, which are highly protective of the kidneys. She connected Janice with a renal dietitian who helped her fine-tune her protein and potassium intake. That was 5 years ago. Today, Janice's eGFR is 36. It has barely budged. That early, proactive referral preserved her remaining kidney function and has kept her far away from the prospect of dialysis. She is living a full, active life. Think of a nephrologist not as the doctor you see when all hope is lost, but as the expert co-pilot who helps you navigate the storm and land the plane safely. They are your best ally in slowing the progression of this disease. So, my final questions for you are these. Do you feel empowered to have a conversation with your doctor about a referral if your numbers meet these criteria? Do you view seeing a specialist as a proactive step toward a better future rather than a sign of failure? Your health journey is a partnership, and knowing when to call in the right expert is a sign of strength. Today, we've covered the cornerstones of protecting your kidneys, adopting an anti-inflammatory diet, understanding that food is more powerful than supplements, diligently monitoring your numbers, knowing the warning signs, and engaging a specialist early. You have the knowledge. Now is the time for action.